INICET May 2022 recall based concepts, and let's learn through the MCQs which came in during this exam. Type of autism seen exclusively or more commonly in females. The choices are Asperger's syndrome, Heller syndrome, Kanner syndrome, Rett syndrome. Some students said about atypical autism or typical autism also. So, whatever be the choices, the dictum you should know is all autism spectrum conditions are more common in males except Rett syndrome. So, the answer for this question would be Rett syndrome, which is more exclusive or commonly seen in female. A patient diagnosed with schizophrenia and treated with risperidone developed sustained upward gaze and presented to casualty. What is the next step? Is the question. Reassurance, giving lorazepam, promethazine, or phenytoin. Now, here is a psychotic patient who is put on antipsychotics and develops upward gaze, which is an acute extrapyramidal side effect. We are talking about acute dystonia here. In patients with acute dystonia, how would you like to treat these patients? It is by giving injection promethazine. A lot of students would know promethazine more by its trade name, injection phenargan. So that's quite common treatment for patients with acute dystonia in antipsychotic exposure. A patient has had episodes of mania and currently having hypomanic symptoms. Which of the following medication is most teratogenic and to be avoided? When you're talking about the choices given, lithium valproate, oxcarbazepine, some students said clozapine, some students said olanzapine were choices which are given. Doesn't matter whether it is clozapine or olanzapine. It's easy to answer this kind of a question. First of all, what kind of treatments are available for mania and hypomanic patients? You have the antipsychotics, we have lithium, we have valproate, we have carbamazepine. Now, oxcarbazepine is similar to carbamazepine, but not necessarily as effective as carbamazepine. In fact, out of all the drugs, carbamazepine is least effective in managing manic symptoms out of the list here. Now, what you need to know is lithium is very well known to cause Epstein's anomaly, which is a problem which we would like to avoid in pregnant women. So, we would like to avoid lithium. But what you should know is valproate and carbamazepine is way more teratogenic than even lithium. In fact, recent studies have shown that lithium, even if given in pregnant women, the chances of Epstein's anomaly is not as high as it is expected. So it is relatively safer compared to valproate and carbamazepine. So you should avoid valproate and carbamazepine. With this knowledge, what do you answer? You would answer it as valproate. Understood? Valproate is the one which you would try to avoid giving in pregnant women. Antipsychotics are safer. Lithium is relatively safe. Lamotrigine, which is used in bipolar depression and all, is also quite safe drug in pregnant women. All of the following statements are true about bipolar disorder except prevalence is about 1%, bipolar 1 is similar in both genders, bipolar 2 is more common in females, 5 to 10% succumb to suicide, more common in age groups of 35 to 45. A basic dictum to answer this question is this. Bipolar clinically presents little earlier, about a decade earlier than depression. So depression generally presents around 35 to 45 years of age, whereas bipolar many a times presents in and around 25 years of age itself. In and around 25 years of age itself. Understood? So bipolar presents much earlier, whereas depression presents little later. So the statement which is false out of this whole is more common in age groups of 35 to 45 would be a better statement for depression rather than bipolar disorder. So the rest of the statements are true. Bipolar disorder is quite prevalent, about 0.5 to 1% in the general population. Bipolar 1 is same in similar in prevalence in male and female gender, whereas bipolar 2, which is more common in female gender, about 10% of them succumb to suicide because of bipolar disorder, right? A middle aged patient with alcohol related hepatic dysfunction presented with withdrawal symptoms. Which of the following is a safer medication to consider? Which of the following is a safer medication to consider? Now, you need to know Um, Benzodiazepines are the treatment for patients with withdrawal symptoms. Now, all benzodiazepines kind of work very well, but when there is liver dysfunction, lot benzodiazepines are more safer. What is that lot? Lorazepam, oxazepam, and temazepam are much more safer to give as drugs to manage withdrawal symptoms. Now, with this knowledge, you know the answer. The answer is lorazepam, which is much more safer in liver dysfunction to treat withdrawal symptoms. An image based question was asked. The right image is very difficult for us to know. So I kind of made it very easy with the choices which they gave: N1, N2, N3, and REM sleep. What you need to know is, as per the student, something related to extraocular eye movements were given, something related to sleep rhythm was given, the EEG waves were given. So you need to understand, if they're talking about sawtooth appearance of waves, then they're talking about REM sleep. Minimal chin EMG recording. If they're spoken about chin EMG recording and there is minimal artifacts and it's almost like a flat line, then it's again suggestive of REM sleep. Very important feature is when you're looking for the extraocular recordings, EOG recordings, you would see rhythmic eye movements which are typically happening in REM sleep. In REM sleep, you have rapid eye movement, right? So you will have typical rhythmic extraocular movements which can be captured by the EOG. So these are important clues to say it could be REM sleep. With what the student said, most probably it looked like it was an image of an REM sleep. So remember these key points for you to answer.